Did you know that 80% of vision problems worldwide are preventable? As we age, our eyes become our secret weapon for overall health. But are you giving them the attention they deserve? Welcome to today's video. I'm Dr. Aisha Butt. Thanks for tuning into our channel. Today, we're focusing on an often overlooked aspect of aging gracefully, your eye health. I'm going to show you how taking care of your eyes isn't just about seeing clearly, it's about safeguarding your entire well-being. Let's dive in and see what the future holds for your vision. As we get older, our eyes undergo changes, and so does the skin that frames them. Let's explore 5 common eye problems and skin changes that come with aging. Number 1 on the list is something that we can visibly see. As we age, the skin around our eyes loses elasticity. This sagging can cause ptosis, where the upper eyelid droops over the eye, sometimes even leading to visual field defects, especially in the upper portion of your vision. It's not just about looks. These changes can affect how well you see. Additionally, the meibomian glands, which produce the oily layer of eyes, often become less functional, leading to dry, irritated eyes. Number 2 on the list is presbyopia. Have you ever noticed that you need to hold things further away to see clearly? That's presbyopia. After age 45, the lens of your eye becomes less flexible, making it harder to focus on objects up close. This is a natural part of aging, but it can be frustrating. Number 3 is cataracts. Cataracts are a clouding of the eye's lens, and they can develop earlier in those who don't protect their eyes from UV rays or in people with diabetes. Certain medications like steroids or nasal sprays containing steroids can contribute to early cataract formation. Number 4 is macular degeneration. Age-related macular degeneration, or AMD in short, is the leading cause of blindness worldwide, affecting central vision. It is linked to aging, but it can also be influenced by lifestyle choices such as smoking or poor diet. Maintaining a healthy lifestyle can reduce your risk of AMD. Now, the good news is there are ways to prevent these signs from developing prematurely. One of the most effective ways is through diligent sun protection. The delicate skin around your eyes is particularly vulnerable to UV damage, so make sure you're wearing sunglasses and applying a broad spectrum SPF daily to prevent wrinkles, the fine lines, and pigmentation. Keeping the skin hydrated is also key. Eye creams with ingredients like hyaluronic acid, peptides, and retinol can help support collagen production and keep the area looking plump and smooth. And remember, when applying anything around your eyes, be gentle. Avoid pulling or rubbing the eyelids, which can lead to irritation or even further wrinkles. Don't forget that your overall lifestyle plays a big role. Staying hydrated, eating a diet rich in antioxidants, and getting plenty of sleep all contribute to a more youthful appearance. If you're already noticing these signs, there are plenty of treatment options to help restore the skin around your eyes. For fine lines and wrinkles, treatments like Botox can smooth out skin by relaxing the muscles, while dermal fillers can plump up areas that have lost volume. For those looking to improve the overall texture and stimulate collagen production, laser resurfacing is a great option, like IPL or red light therapy. If puffiness or bags under the eyes are a concern, small changes like reducing salt intake and getting more sleep can help. However, for more significant results, in-office treatments like radiofrequency can tighten the skin and boost the collagen production. The blepharoplasty, a minor surgical procedure, can remove excess skin and fat for more dramatic improvement. Dark circles can often be brightened with fillers, which restore lost volume beneath the skin, while intense pulse light IPL treatments can target pigmentation and improve skin tone. Sagging eyelids or ptosis may require a similar approach, with radiofrequency helping in mild cases and eyelid surgery being more suitable for severe drooping. For skin tags or lesions, it's important to have them examined by a professional. They can be removed if needed, but more concerning lesions could be a sign of skin cancer, so regular checkups are key. Early detection is essential for effectively treating conditions like basal cell carcinoma or other more high-risk skin cancers. Taking care of the skin around your eyes is about more than just looking good. It's also about protecting your vision and eye health. With a combination of preventative care and the right treatments, you can keep your eyes looking youthful and bright. If you're ready to explore personalized options, schedule a consultation with your doctor and skincare professional today. UV rays accelerate aging of the skin around the eyes and increase the risk of cataracts. Always wear sunglasses that block 100% of UVA and UVB. Keep the skin around your eyes hydrated with a good quality moisturizer, and always apply sunscreen to protect against further skin damage. For age spots, vascular issues, or fine lines, treatments like IPL or intense pulsed light or photofacials can be effective at removing these blemishes. Radiofrequency treatments can also help boost collagen production, reducing sagging and taking years off the appearance of your eyes. For macular degeneration, foods rich in antioxidants like leafy greens and fish high in omega-3 fatty acids can help protect your eyes. Staying hydrated also supports healthy skin and tear production. Once again, schedule regular eye exams to catch issues early. Early detection is key to managing conditions like cataracts or macular degeneration. So what is the treatment for presbyopia? Although there is no prevention from getting older, any 40 or 45-year-old will need reading glasses or multifocal contact lenses eventually. The problem with reading glasses is that when you put those on, you can read very nicely. However, looking up, your faraway vision can be blurry. So for that reason, bifocals or no-line progressives can be a better option for those who want to look better and not have their glasses on their nose. I hate it when someone walks in and their reading glasses are on their nose and they're trying to look above the reading glasses. That's essentially what progressives do for you. Progressives have essentially either a plain glass or your distance prescription at the top while the reading is at the bottom. So when you read, you look through the reading prescription. And when you look up watching TV or driving, you're looking through the right prescription for distance. So you don't end up putting your glasses on your nose or seeing blurry at distance. Ask your optometrist about what's the best option for you. In today's video, we've seen how crucial eye care is for overall well-being. Remember, our key takeaways. Regular eye checkups are a first line of defense. A nutrient-rich diet feeds your eyes from within. UV protection is a must, and kicking that smoking habit isn't just good for your lungs, it's a sight saver too. By prioritizing these simple steps, you're not just preserving your vision, you're investing in a brighter, healthier future. Now, it's your turn to keep the conversation rolling. Drop your own eye health tips or questions in the comments below. Your insight could be a game changer for someone else who may need it. If you found the video eye-opening, don't keep it to yourself. Hit that share button and spread the vision of healthy aging. And for more nuggets of healthy wisdom, make sure to subscribe and ring that notification bell. Remember, when it comes to aging gracefully, keeping an eye on your health is the way to go. See you in the next video.